11 and 12 is just like inconsistency of people because you know what's
Yeah, because that's when some of the kids are already done and
yeah, and then it's
in the
lunchtime and people are rotating, so it's
Yeah.
kind of,
but they have the same requirements when it comes to transportation,
yeah.
the education piece. And how long
Do they have endoscopy here?
No, at Falls Church. But in a couple of years they'll be coming in here to the third floor.
They're coming here?
As an
They keep
addition,
saying, hi.
as an addition, or
How are you, Janet?
Hey, good.
Good.
So Falls Church is not gonna be indoor anymore. It'll be here.
I think she's retired. The boss. Everybody.
she's retired.
Yeah, she's a very focused person.
Where was she? Wasn't she?
Get things done.
She's here.
My first experience was like the worst with her. I didn't know. I was a new tech with Rachel. I came here and I got into the wrong elevator with my street clothes. Man, she yelled at me. Who is she? What are you doing in my elevator? I'm just trying to. Yeah, this is a. So.
But you could
And
use
I-
that elevator maybe a little thing. You just have to get out the other side.
Yeah, I mean, that was like 7 years ago. I was new. I didn't even know which way I'm going. She yelled at me. I was like, oh my goodness, what did I do? I told Rachel, that's bad. She's like, she shouldn't be doing that. So she talked to her. She did talk to her. She went and talked to her. But after that, I mean, no, it's just, the first time I met her, I'm like, new guy.
But it's good to have that support behind you.
I was
though.
like, oh yeah, what? We finished the simulation, she wanted to talk to her. I was like, shouldn't be doing that. So, but I was like, oh my goodness.
The regional
But,
director position.
yeah, then every time she needed something, she one time she was like, I want you guys to go to Falls Church. And we're like, why? Because I want the basic assessment for my nurses. I want them to start listening to lung sounds. I was like, oh my goodness. She's like, yeah, they're not. I really want that. So we started Falls Church. I really want you to go there and do more code therapy.
I think they'll have another regional. Probably not.
I doubt it.
They're gonna say that's not a critical position.
And it's
That's
Joe. That's Joe Butt's idea. Regional person.
Yeah,
I don't know
CDU we need
if Lawrence is gonna go for that structure. It all
for the
depends.
CFO or the who is it? COO?
He took Joe Butt's position. Lawrence. The British guy. Accent guy. Do you want to check if the video is working?
just need then for Patrick Clear, I just need the nurse and the ENT. That's it. That's just two people I just need.
Well, if they call for help,
Right.
then you need those
Or
people.
maybe I keep 5.
Yeah, that would be good. Like having 5, 8, 6 people.
Okay.
But then the rest can go to that.
Yeah, we only can have 7 there. So for 1 o'clock, I can't do that.
Wait, how are you getting 7 here and have overflow here?
So each of the rooms, there's a limit to how many we could have. So there's like number limit there.
What's the limit in the OR this morning? There was no limit. There was
I
like
know.
30 people there.
I know. See, there's no numbers here, so.
Yeah. I take your patient. You can't take your patient.
Yeah, right?
You
It
can't say
have to
that.
be 6 weeks. So, yeah. It's very consistent.
Even for us,
Right?
the patient, right?
Oh, who do I address it to? Every time I go to the tent upstairs, lobby, they always ask me for porta potties. So who
The
do I address it
MCM,
to?
yeah, Bobby.
Tell Bobby that.
Yeah.
Okay.
What? Because they can't come in? Because they're like considered dirty.
Yeah, that too, and like sometimes it's hard to wait until your break comes to work out and go. Right? So then they have to wait, get all
Doctors, yeah.
So they were asking if they could have like the triage in the back here. There's 2 places there. Yes, one night. 11 o'clock.
Hey, how are you?
This is we're done. License, right? After
And
this.
then this is it.
For the rest of the year? Yeah, okay.
Everybody's done, right?
No,
No.
Friday I have Aaron.
Oh, what is he doing?
Hmm?
What is he doing? Typical Airway too? No, I think he
No,
already did that.
MH2 code.
MH.
Where's that? Softball. And then, is he missing something?
I don't know what else he's missing.
Largo's done, right?
Largo's done.
So last
How
I
about-
was saying that difficult airway is not
I think-
part of the requirement, right? But
It is.
Are we? Because she keeps saying it's not.
Who?
Yes, right.
No. So the way they categorize is considered as disaster.
Yeah, I can see that. Yeah.
So, but disaster training, you can whatever you're lacking, or having issues or having gaps, can be your disaster. So when I talk to Marla, now COVID-19 simulation is a disaster for you guys to do.
So is that going to be like every year now until it goes
I don't know
away?
how long, but it's well, I don't know how long it's going to stay. But COVID-19 is a disaster. Hemorrhage. She said hemorrhage is something that you guys should be doing, and then difficult area.
So you guys are going to come for simulation for hemorrhage too? Is that what it is?
So yeah, if we designed it, yes. I mean, if that's what we're doing next year, but we have to really work on what it should be looking like for next year. What are we doing? Where are we going? What like incapacitated healthcare worker? We don't have to be there, but there should be a checklist
Yeah, we do.
that you guys use and report back, so we know that what was completed. And then there's another one as well. Fire in the OR.
Yeah.
So
You
that's
don't have to be there for that either, right?
we don't have to,
Okay.
but you should have a documented, not the whole building.
Right, here.
It's just specifically the OR. You have a fire in the OR. How
Yeah.
do you manage that? So
Because I was told that as simulation, there was just like code, kids and adults, then this MH.
everything is a simulation. So
Well,
where
for you guys to come simulation.
yeah. So ours is you conduct in service. You do like a training, and then you test the process if people kind of retain what you taught them.
Right.
So
Yeah, I know.
Yeah, I was like,
I haven't had a break, so I'm hungry. So I'm just wondering.
so what depends how many people it's like. So if I have
Thank you.
person else
Sila
is
si
What is
Ahmad,
it?
matamay din mo ano lang.
I was like, well, I'm on first, and then dinner over here.
Ah,
Well, I mean, I just
supan.
it takes people on it.
well, because this will be like around 11:40 because we'll have to get ready for the 12 o'clock. Yeah, so it just be if people don't show up, it's short.
Yeah, yeah. Yeah, she just came back. Oh, you were down short.
Especially the effectiveness tool should be done. The post tool should be done. Yeah. So the goal is really to have a pre-education, then simulation. Each
They're on their way.
you're here again.
Sure. I already did, yeah, all the knowledge that I have, yeah. You know, how many rooms are you going?
Oh, true.
That's good one.
So is this, are we waiting for staff to?
Yeah, Maria's working on it and it's just kind of so.
I don't think the 11 o'clock works. Last time, remember, we waited, and we ended up doing the 12 o'clock.
So
So
I'm not allowed to change anything, but I can just wait. But they know.
Change the time?
I think they discussed it and they just decided to keep the time as it is.
And then again, 12 o'clock?
Yeah. So like how they try to do it is 11 o'clock will be the morning shift and then 12 o'clock will be the afternoon shift. But it just kind of gets intertwined. Sometimes like my boss here for one of the things we didn't have to
usually,
Like
I mean, it's
11:30.
always because they end up doing patient care,
yeah,
and
you know,
it's
lunch breaks and,
and
just,
everybody have to, guard people, figuring out who's coming, who's
Because
going.
they're coming in at 7, say.
7 o'clock, nobody's, there's no
No,
kids,
they're
there's
coming-
nothing.
Yeah, but the people coming at 7 have to take a lunch at 11. So they're leaving
Yeah.
at,
Yeah.
I'm assuming
so a
at
couple
3.
people come at 6 also.
So this is really lunchtime.
Yeah.
So there's
starting at
lunch coverage and
exactly. So there's always that transition.
11 to 1 actually is very lunch busy
Yes.
coverage.
So even
patient.
anesthesia is like lunch coverages and things like that. So
Doc was like, Mike, I have to relieve someone from inside.
Hey, Eric. Hi,
Oh, look
Eric.
at all the fun.
I used to work with him in the
Yeah, we did this last time. What was it?
it was a code.
He was the primary nurse. He did a really good job. And he's
I
like,
told-
he can do this in his sleep.
No,
that's exactly what he did.
No.
I told them that you were complimenting him.
No, you get I like it when it's like just calm and you talk about it, you learn about stuff.
Eric is here, Jim is coming.
Terry just went out for a second, but she's.
Whoa.
We're here till like 2.
Does anybody have?
So every day we're a different center, different,
Yeah.
pretty much.
Let me see if,
Like this is like you do all the time.
Yeah.
Wow.
Eric, you sleep?
Yeah, I run into Corey in the BCSM area.
So is Corey, I know Norm's a director. Is Corey a director?
She's a con.
She's
She's a
a
com.
com in internal medicine.
What's his, and she works in
Cassia.
So Norm is, what's his department?
He's like medical specialty and some internal medicine. I always get confused.
Did you ever work with Alan Jet? Did you work with us at Potomac?
He was, yeah, I didn't work with him then, but he was CD director, so he was the director I had to work with.
Yeah, he's a character.
And he tells me that too. He's
Yeah,
like,
he'll even,
"Oh, I
yeah,
feel
he'll
so-"
even admit it himself.
Yeah, he
that
did.
he's a
He
character.
said, "I'm so sorry, you have to." Because it was him.
Jim's on his way.
So I had two of them trying to
And then
get them
Sandra.
to agree on
That's it.
what do you want your
And you.
nurses to know.
I was
He
gonna
was like,
add it.
Oh.
and she's like, they need 30 things. And I'm like,
Terry,
you
I was gonna
can't
ask
do
you to
that.
be the nurse.
I miss Corey. I'm sure Corey's still the
Because Eric
same.
did it last time.
She's still
And
the
then
same.
Sandra did it
I
last
love
time.
Yeah.
And I think Jen did it.
Yes. Well, I'll tell you what, you're not getting that. Don't get on that lady's bad side. Your life is not gonna be good. She's fair. She's a very fair
No,
person.
don't get on it. No.
But don't mess with
No,
her.
you know,
Yeah.
somebody walked in her office without knocking.
She's a character.
She ripped them up.
So much fun at Potomac.
Norm stuff. Then he tries to act professional, so then I cracked up. I was like,
Did you run into Alan? You ever see Alan?
no.
Yeah, he's
I
some
don't-
kind of big
he's,
boy now.
oh,
Oh,
he's VP now.
He's way up there.
One
It's
step
like
down.
4 or 5 different layers before he gets to me, so I don't get to know.
That's off
Which
too.
I'm okay with.
That's a lot of politics, a lot of.
I can't.
Some people have that gift, not me.
I
You know? I'm in trouble.
Yeah. Straight shot, black and white.
Yeah,
Can't see gray.
yeah.
There's a lot of politics up there that day.
You gotta be willing to fire people too. And Alan will definitely fire you. He has no qualms.
What did he do at Performance? I never
Was he a lead? Was he a charge? I know maybe he did charge. I don't think his career really took off until he came to Kaiser. I think when he came to Kaiser, then it was just.
I knew him when he was an assistant director under what was that guy name?
Do you know? Did you guys know Joseph, the black guy? What was his name? Oh, I know you guys know him. I'm not saying it right.
What did
He always color coordinated the scrubs. Oh, what is that guy's name? I know you know him. He used to be a director, assistant director. Abraham.
Oh yeah, yeah.
Abraham.
Yeah,
That's
yeah.
it, Abraham.
Yeah.
Remember he
Yeah,
always
he was
coordinated
at Largo.
scrubs? So is he a manager? What is he?
Well,
Now?
he went to California now. He's a director somewhere in California.
What's wrong with us?
I don't know.
I know, we're all like.
Staff.
He was a cop for a long time though.
Man, we like to have fun. Maybe we have a this is like too much. I mean, I don't think you can. They prioritize that. Maybe I can't.
Well, you know my thing is too. I'm a very social person and I enjoy having fun with people. And when you get to those levels, you gotta be able to separate the two. You're not there to make friends.
Yeah.
You're there to kind of.
And then nobody's comfortable friends either.
Yeah.
They're just like, I don't know if you're the older or younger.
I know.
You know.
I wouldn't
Sometimes
do
I
that.
feel that way. And then I was like, I know I'm being professional about, you know, making people. So you have to be careful. And he has to be careful, I think, too, because.
Are we gonna get started?
You know,
Maria said,
because he has to treat everybody the same. If they're like friendly with me, with his professional someone, they often we do.
so with the simulation for like the code release of the science
Jealous.
is that the
Oh.
majority that you show up for?
Yes.
Right.
Where is she?
Yeah.
Or once in a year?
So with the code blue you have to do adult and teens, so that's 2. And then for MH the same thing.
I think I work
For
with.
difficult airway depending on the site. If you do peaks, we do peaks. So
Yeah, okay.
2 for each scenario.
Yes, the ones at the beginning. Yes.
Huh?
Someone said she's
Every
still there.
month, every year, then? Or-
No,
The other one.
we spread out those dates.
Like,
Like,
oh,
She's
all
an
of
MP,
them,
or she-
it's
a nurse
different
practitioner, or
dates.
she works at the
fancy
satellite.
surprise, too.
What's the other one? You know, Woodbridge. There's the main
Yeah,
center,
you're
and
good.
then
You're
there's
good.
the other
Yeah, we don't
one.
surprise though. We just
Like an
everybody
architect
knows
they
that
have.
we're coming.
You know what?
No.
Small
That's
town,
the
right?
scenario.
Oh,
Yeah,
we're doing
the
different
center.
one.
Today we're doing different Airway.
Oh, yeah, no, I
Are
can
you
do
gonna
that.
be the physician?
Yeah.
Okay. So,
The
so
name of the city
really,
started in our location.
yeah, well, the
Does she
the
work
goal
for
is
Tyson
really
up there?
really to go through the Airway algorithm and trying to see, try to innovate,
Some
can
system.
and ventilate to go through
She
the
said about
different
nursing.
tools that you have using the algorithm, and then eventually you can do anything. So you go through the ENT process. So that's
Oh wow.
the logistics.
You know,
is
they
the
really got
hard
their act together. Did you know that?
This,
They really did. Did you
knowing
see
where
there's a
things
special
are,
on
and, you know, calling out things.
PBS? Maybe it's on
The team
football.
dynamic. Those are the
Like,
areas
yes,
we really
they
focus.
really
not
handled
about
it
the
well. They really had their act
clinical
together.
outcome.
I understand.
Although that's
That's
important,
what
it's just
I'm
really the team dynamic, communication,
Wow.
resource allocation.
And they even have like a couple outbreaks. She's always doing like public health officials. And I'm like, what's going on now? What's going on?
Second wave, right? No. Second wave. We're barely getting through the first wave, right? I mean, we're not like look, England definitely has their second, Germany, France.
Yeah, we have not
Italy.
gotten yet ours yet.
We're not even really done with the first wave, are we?
Right, we're
Not-
not.
Yeah, not really.
Not really.
Not really. That's the
We keep. I mean, we're at 100,000 cases a day now.
I know, it's not even
It's,
a second.
it's like the craziest thing. Although I think DC, Maryland, Virginia, they did a really good job though. Maryland did.
Did you see the news story where in Italy, I guess these hospitals are so overrun where they don't even take you out of your car. They have you lined up in the parking lot. They bring out the O2 to you in the car, and they have your IV, and there's no beds. There's physically no beds.
I feel you really learn it.
Yeah. Sit there and say that you whatever. Is it Utah that hasn't been somewhere that haven't been?
Yeah, Midwest, a lot of Midwest are out of it. Plus, the problem is they're like 45, 50 minutes from
I had never
where you
done
live, the hospitals. It's ridiculous. And then you go there and you only have like 5 minutes.
I saw something. It's El Paso is getting it, but Texas is getting it bad.
Yeah, Texas is getting the highest number.
Well, that's what I'm saying. They're saying this Thanksgiving is going to be very interesting. Like everybody's traveling,
It's just becoming the
tons of groups are
I do.
putting together.
I feel like
You're not paying attention.
Yeah, I know.
yeah, it's definitely changed.
And
Do you do any?
Because we never really.
There's
We were like anticipating.
I brought it a lot. I hope the road be out.
I did. I hooked the rookie up.
and change the hospital.
And you guys are
Before I
going
say
to
ski.
I remember that, yeah.
For the spine.
So we
We
did.
were
Michael, there's only just start.
Yeah, we can.
Yeah.
We're just waiting for
She's
you.
1.6.
Well, she said she was gonna send one more. She told me to wait, but it's already another 20. So
Yeah.
Who's our team?
Who's our core team? Come on, guys.
Can I be the nurse that finds it, that calls the dog?
Yeah.
Is that how- okay.
Yeah. Roll assignment. He's already started. Jen will be our nurse.
taking the patient.
Oh,
No.
No, he wanted to be the
Let's
nurse.
get it over with.
So he's gonna call for help.
Do it. Do it, Eric.
I'll be the nurse. who finds
You
it.
got this, Eric.
Yeah.
Is
What
our
were you-
recording?
Yeah, coming. Let's get started.
Okay, perfect. Is that all right?
Quick
Yeah.
overview of what's gonna happen. Okay. Alright, Dalia, the
Alright.
floor is yours.
So we always start. So good morning, good afternoon, good morning or
It's
afternoon.
still morning.
Still morning.
Yeah, 40 minutes.
I'm Dahlia. I'm the CD educator, but I'm helping Michael out with simulation. And what we do normally is, you know, when we before we go with the scenario, we always talk about team dynamics as well. So you guys know the 4 domains of the team dynamics, and somebody could please say which are what are we focused on when we talk about team dynamics or team training.
You mean like who's in charge?
Yeah,
Who's in
there
charge?
you go.
So that's leadership,
Yeah.
right?
Leadership.
Assignments.
Closed loop meaning it's communication, right? So we want to make sure we close the loop with not just medication, but also with everything that we do. So make sure you're closing the loop with the person who's giving you the orders, okay? So that's really important because then that triggers the next step to happen. So you guys also mentioned leadership, right? So leadership, you want to make sure that you have roles assignment, right? And the other piece of leadership is also like flattening that hierarchy, saying, you know, making sure everybody gets a chance to speak up. And that's just simply like if you're leading a code, let's say, you want to say, is there anything else I'm missing? Any other suggestions, right? You hear a lot of physicians say that. And that's just to say, okay, we've done this, what's missing? So that kind of takes the leadership, you know, that hierarchy out and then focus on the patient. So that's what we really want to see as well. And then that engages also the everyone to be able to speak up, okay, for patient safety. So one thing I didn't mention on communication also is you're the core team. So when your contingency team comes or when your help comes, you want to give them that quick report. So how do we give that quick report? What do we say? What is that acronym that we use to give report, like a quick critical? SBAR, right? So we say RSBAR and kind of, right? Because we want to say your request first. I need this patient intubated, let's say, right? And this is the situation, the background, and the assessment can be just quick, right? He's in respiratory failure. You can just even use the diagnosis. I need you to intubate. So that's what we want to see to just kind of help you guys practice that RSBAR, because if you don't practice it, it's really not that easy to kind of articulate your thoughts into that. So we're not going into like run-on conversation on what you want, because you want to just say your quick, you know, your request. The situation should be just what's going on with the patient currently, maybe a couple of vital signs, right? And your background should be just, he's here for this surgery, this is what happened so far. So not, you know, anything else, but just focusing on what would be pertinent for this person that you're asking for to make a decision on what the next steps are. So what are the other two domains?
So we said leadership, communication.
Other two is, one of them is situational awareness, right? So we want you, if you saw the SATs are going down, you want to say the SATs are dropping or the rhythm is changing. So then you have everyone kind of, it triggers everybody else to do something else, right? Depending on what their roles are. So we want to create that situational awareness for ourselves, making sure that, you know, like let's say you're going to see your anesthesiologist almost to pass out, for example. You know, that's what you want to make sure you're like keeping an eye on each other in that way. Okay, so everybody's aware. And the last one is the mutual support. We just put a name to it, but we do it all the time, right? I got your back, you got my back, right? And how do you guys do that in this setting? What would you say is I got your back, you got mine? What do you guys do?
Sort of, well,
I don't know about him, right?
You could just say, yeah, let's say I want you to give atropine or epi or whatever, you can repeat the order back, good job, or you're just kind of confirming what they're doing. Is that what they're saying?
Yeah, so you're supporting each other. So you're saying yes, like let's say, okay, I don't know how to do this, you know, this medication, or I don't know how to hook them up to the monitor, for example. So it's like, let me show you. So speaking up also is that mutual support. Like when we ask, we call it task assistant. So we are very good at giving the assistance part, but we also need to be really good at asking for assistance when we need it, when we don't know how things are done. So in a simulation setting too, this is your safe space to practice. There's no quiz, there's no test, there's nobody judging. So this is kind of your space to practice. And the only reason we do videotape it is so your team members can see it in the conference room, and then we use it for annotation as well to just kind of see, you know, what you guys do really great. Like we share the video and then say, hey, this is how to do it right too, for education purposes. Right. Any thoughts, any questions? And then the mannequin, you know, if you haven't worked with him for a while, come and feel his carotid pulse. The scenario, if you're looking at him and he's got a stronger one on this side, because if the scenario is going, if you want the pulse, we just expect you to check for the pulse. So he's got a carotid pulse. If you wanna put him on your Philips monitor, this is your Philips connector. I see you guys have your Wi-Fi, but this only goes to the Philips. He already has the pad on, so this is your connector to be the pads. Okay, but your rhythm will show on the monitor what's showing on here. So it's kind of like this is your bedside monitor, and then you can use it as your defibrillator monitor. So this is your bedside monitor. It has everything, and then it's like an A-line type of blood pressure, so you don't have to recycle it. So this is your real-time vital signs as it circulates, and then he's got the end tidal CO2 attached to him, so you can see his end tidal as well. Do you have temps on him, or?
Yeah, we can give him.
So we can put a temp on as well, just so you can see what his temp is. All right, we're good to go.
Yep.
And I'm gonna read the scenario.
So
Right,
I
perfect.
just wanted to clarify, you said the difficult airway part is where?
In the OR.
In the OR.
yeah,
So we have to go into.
I'd rather because I have my stuff.
Okay, I just wanted to
But
like,
other cards you guys can
feel
have.
like if I'm supposed to go get something, I just
Yeah.
want to know where it's at.
Yeah, but
Is
that's
that-
part of the education though. If you don't know,
Yeah.
then this would be the time to figure out, hey, I don't know where that equipment is.
Right, well, that's why I'm asking before we
But
even
if
start,
you,
because.
if you prep prior, then it's not really helping,
Oh, that's good.
you know?
Yeah, but she can go in anyway. But if
Right.
it's an emergency, you can just go in there and get it.
Okay.
No, who is able to get it? Is anybody?
Anybody.
Anybody.
Mhm.
If you're in an emergency, there's
You don't need to
being
worry
So
about
sterile
the
it.
is
main part
out of
is
the
in the
question.
same spot?
Yes.
Okay.
Yeah, you
So like if it was anesthesiologist, they said go get the airway part, and that's where you're gonna go straight down there and get it.
Right. Airway, typical airway straight down the hall. Okay. The hall. The left side.
This sounds silly, but is that
Not at all.
different from what the airway stuff that's in the crash cart? Is that different or?
It is different. It's got the trachs and things like that there for emergencies.
Oh,
For the difficult airway procedures,
okay.
situations.
I feel like we don't get that stuff very often.
I know.
That's why I'm-
So that's why I was asking. So I didn't know if that was different.
Any other questions? So the scenario is, this is Mr. Tom Jones. He is 55 years old, no known drug allergies. He is 5'9", 95 kilograms. He just came out from the OR with emergency laparoscopic appendectomy. His medication includes atenolol, hydrochlorothiazide, and lisinopril. Past medical history includes hypertension, hyperlipidemia, and CAD. Patient just arrived in the PACU and is drowsy, drooling, and difficult to arouse.
Okay, perfect. So I'm gonna present myself to the patient. Hello, Mr. Jones. I'm looking at my patient. Is my patient moving air as I look in his mouth?
Does he
Wait,
have-
did he even have an
have an
airway?
Yeah, that's the question I was gonna ask. Does he
Yeah.
have an airway?
No,
Okay.
no airway.
Okay.
And is my patient breathing? Am I seeing? Okay, perfect. I'm gonna quickly go ahead and listen to breath sounds. Am I hearing equal bilateral breath sounds?
for now, yeah.
All right, perfect. I'm looking at my monitor. I have good vital signs here. Do I have fluids hanging? Yeah.
Yeah.
Okay, normal salience hanging.
Just came out from the OR.
How long's my patient been out? Just came out?
Just
He just
came
came
out.
out.
Okay, trying to elicit some type of response from my patient. Is my patient waking up at all?
No, not yet.
No.
No. Okay. And moving air, clear breath sounds noted. Vital signs are looking stable on here. I have a good end tidal CO2. My blood pressure looks good. And how's my IV access at this point? Do I have good IV access in place?
Yes.
Okay, perfect. I have the sinus rhythm on the monitor. I'm waiting for my patient to wake up. I am seeing a decrease in SATs here. Is my patient? I'm gonna go ahead and put my patient on oxygen. I'm gonna put him on the non-rebreather for now. And go ahead and reassess breath sounds. I still have a good rise and fall of the chest. My blood pressure is dropping a little bit here. I'm gonna go ahead and just quickly, just because the scenario, I'm gonna assess for pulses. Do I feel pulses in the peripheral and at the carotid?
Carotid, sure.
All right. Pulses there. My end tidal there is dropping down a little bit. I'm gonna go ahead and open up a little fluids at this point. I'm gonna go ahead and reassess for my breath sounds here. And what's my patient's current respiratory rate?
You don't hear any.
No breath sounds? Perfect.
No.
All right, and what's my patient's respiratory rate at this time? 12?
12.
Okay, decreasing SANS. I'm gonna go ahead and assist my patient. I'm gonna have the ambu bag ready if I need to help him breathe.
Oh, there he is.
They're
He called
89,
help.
so I'm gonna say, can you go get me the ambu bag? Make
Yeah.
sure my suction is hooked up. Do I have any
There's the ambu
secretion?
bag right there.
Do I have any secretions in the mouth? My mouth clear? I'm gonna go ahead and do a chin lift jaw thrust here, and
And then have somebody call anesthesia
yeah,
staff.
we'll get anesthesia staff. I'm gonna BVM my patient up here. I'm bagging the patient up. Is my patient having a chest rise and fall with the bag valve mask?
No.
Okay. I'm gonna put an OPA in place, make sure that tongue is secure. I'm gonna have somebody hold seal and ventilate. Is Dr. Coven here yet?
Oh, sure. Am I still here?
That's all right.
They call.
You okay, man?
Okay.
You want me to get the crash card, Eric?
Yeah, crash cart,
Okay,
please.
crash card.
Are we able to ventilate the
Yeah.
patient?
Are we hooked up to oxygen at 100%?
Right here. There's one right here.
Right here.
Carol, I'm gonna assign you to do back.
Can't ventilate.
You can't ventilate?
Yeah, ventilate. Someone give me a breathing tube
Okay.
and a
Someone wanna grab the difficult airway box? You have a card?
Yep.
Alright, what do we have?
Everything. Yeah, you can open your.
Somebody has to be a recorder.
Not the drug though.
Not the drug.
Not the drug,
drugs.
except.
Okay.
I guess that's.
Do we have a tube and a laryngoscope ready?
They're bringing that right now, Dr. Coven. And what size tube do you want me to get ready for this patient, Dr.
A 7.5,
Coven?
please.
7.5.
So just a little bit, Jim. Okay, you can't use it.
And I think down here, Jim, we do have a roll. I'm gonna go ahead and pull the roll out and see if what we have is in the roll. You want us to
That's the
actually,
one that Nick made, right?
yeah, you want us to actually pull stuff out or just
Yes.
verbalize it?
And
You want us to go-
okay.
okay.
Open it up.
Can we get some substance
Do they have enough? I don't know.
I know.
milligrams and some accommodate?
Is somebody pulling Dr.
So that's
Coven's
for the
drugs?
difficult airway part.
Dr. Coven, did you want a Mac or a Miller?
Oh, and that's weight.
I get the other,
You can verbalize it, but.
Okay.
The medication.
Okay, I have a Mac 4, this is a Mac 2. So that looks like, all right, so here's your Mac, here's your blade. I'm gonna go ahead and get you a handle. There it is. All right, so I have the handle.
the iris like this.
84.
Alright, so we have all our equipment ready.
Sucks and it's on me.
Go ahead and prepare to give 100 milligrams of, or sorry, we'll give the accommodate first.
Accommodate.
Okay.
Let's give some, and
Alright.
And you're still palpating a pulse.
Accommodate.
then we'll give some.
Okay, sucks as well.
You still have a
Okay,
pulse.
what time was given?
Drugs are drawn up.
11:30.
And Dr. Cloven, what do you want first for drugs?
Accommodate was given.
I have all your stuff set up. You don't want stuff.
11:33.
Yes.
Accommodate.
Okay.
Then intubate. Do I open all this stuff?
So
or no?
accommodate is in.
You could
sucks is
intubate,
in.
you can ventilate. So let's say you went forward and then you couldn't advance.
You actually
You can
what also?
intubate or
You're not
ventilate.
able to visualize?
Sucks and it's on me. 11:30.
Do we have a scope ready for Dr. Coven or the bougie or something else that we have ready? Black
That's
scope?
right here.
Yeah, so we'll give the live
I'm
still.
gonna put this in.
What you said, there's 84. Okay, and am I hearing any rise and fall in the chest right now? No? Okay,
Nothing, huh?
I'm gonna go ahead and have x-ray ready to come up and shoot a chest x-ray.
X-ray, what we call 1933 stat.
Can we say that the glide scope is here and it's prepared, ready for Dr. Coven? Or you want us to actually wait till it
Yeah, I
comes?
want to see if they got.
She's getting it.
Okay.
Where it is.
With the gyroscope? Oh, someone?
Yeah.
Okay.
And I doubt that we'll need this, but we have the cricothyroid kit down there at the bottom. I know we're not gonna need it, but we have it ready. I think it's the next drawer up, or airway.
Fluids, man.
It's an airway, airway.
Rhythm is okay?
We're going 85.
Yep, 85%, 100% on O2 here. Breath sounds haven't changed at this point in time.
We're still waiting for our live scope.
Go away. Let's go. It's coming.
And if we have the difficult airway box here, I can get Dr. Coven the bougie. She can try with that in the meantime while we're waiting for the guys to go.
Yeah, you guys can go ahead and then, if you have to do that, go ahead and then say it.
Yeah.
Okay.
If she needs
So,
the bougie,
if we're
who's
not,
gonna
we
give
don't
her
have
the
that,
bougie?
We would open this card here. We have an
Okay,
orange
here's the
box
glass
that's inside of row 215 that has our difficult airway box. If somebody wants to look at the
Jam already
difficult.
bought the.
Oh, I already have it right here, man. There's a word.
No, there's an orange box
there's
too.
another
A
one.
difficult airway box.
Alright, so
Just
I'm
bring
gonna
that.
pretend that I have this hooked up to my.
I have the glide scope hooked up to power.
Okay.
Take this off. Now I'm looking with my glide scope. Can I see anything? No, cannot.
Okay.
Not visualized. Alright, so
Let's-
do we have a bougie?
They're gonna grab us the bougie now, and I'm gonna have somebody just have the right kit ready.
So, this back
I'm
on.
going to use
We have a right kit ready here.
Went down?
83%.
Okay.
Right here, man.
Perfect. And do you want us to open that too? Our box?
You can open it, but you shouldn't, don't use,
So it actually use
just
it?
for you to know what's
Okay.
inside there.
So we have the emergency cry kit for you here, Dr. Coven, if you need it. We're also gonna go ahead and open
Did
up
we
our
ever get
difficult
the
airway
bougie
box.
to try with the glide scope?
I think he's getting it right.
Is it not in the part?
Yeah, and I'm
Yeah,
not
it's right
seeing a
there.
bougie.
There's
There it
Oh,
is.
yeah.
So we have the bougie for Dr. Coven.
Alright.
Alright, did this help me with the glide scope? The bougie? Okay.
Yeah.
You can't advance with the bougie. Okay, perfect.
Okay. Alright, let's try an LMA and let's prepare the fiber optic.
This the element right there.
I'll make here. And what, maybe a 5?
A 5, he's 95 kilos, correct?
90.
So we have our LMA ready for her.
Okay, so now, I'm gonna place the LMA, can I put the LMA in? Do I get any
It's still not getting
information?
Anything?
No. Okay, so let's get the fiber optic ready and call surgery for a surgical airway.
In the meantime, do you want us to have?
Yeah, we'll have that available, but we're gonna try the fiber optic and we've called for surgery, correct?
And I guess because we're so close to the OR, we're just gonna literally go to the OR and do it versus at the bedside.
So let's say we have our fiber optic. We try our fiber optic. So
Do you want us
can I
to
say
keep
that
going?
we
You want us to keep
tried the
going?
fiber optic?
right.
Okay.
Okay.
So you're trying the fiber optic?
Yes.
Yeah.
It's still not working.
Okay.
Okay.
Alright.
So nothing. Fiber optic LMA's not working. Bougie's not working.
Yeah. Do we have our surgical colleague?
Yeah.
Okay. And are they gonna try now?
We want is the surgery the
Yes,
surgery.
so
can they
you
go
guys
ahead
can
and try?
verbalize the surgical procedure.
Okay.
Okay. Verbal procedure. We're gonna do the crank with the surgical colleague.
Is the crank successful? And are we able to ventilate through it?
And so this would go here.
Yep, exactly. I don't wanna break that. But anyways, so we have the crank in place. We're BVM. Am I hearing cool bilateral breath sounds?
Yes, you're getting some.
Okay,
You're
good
getting-
rise and fall
you're getting
chest.
sound.
And my blood pressure is improved.
Saturation's coming up.
Yeah.
81, now it's 84.
Okay, 89. Here we go.
I still have a good pulse on my patient. Yep, perfect.
And title.
And title's coming back up. Okay.
Okay.
Let's transfer to the hospital.
Alright, you're about to call 911 now.
Yeah.
Who's coming to get him? 911.
911.
Alright.
Oh, that's right.
Yeah, call 911.
No, you have to call 911. I didn't hear that.
Oh, that's right.
And I can't remember for us, intubated patient, the doc goes with them? Or is that only downstairs? I can't remember.
I think here as well, man.
Here
They
as
won't
well.
take the patient if they're intubated.
Especially if you cry.
Yeah, we cranked him, yeah.
Yes.
Okay.
Even just for intubated, I think
Alright,
they won't take
so
the
I'm 911. What's going on? Tell me a report.
Oh,
Let me give a nurse report
yeah, go
first.
ahead.
So this is Mr. Tom Jones. He's a recent, if I not remember,
patient.
appendectomy
Happy.
surgery. He came out of the OR, was somewhat lethargic. His LOC decreased from the time that he came out. We noticed a instead of his end tidal going up, his end tidal was going down. A drop in LOC. Then we noticed decreasing bilateral breath sounds with decreasing SATs. Numerous attempts were made to open the airway. We were unsuccessful with the BBM. We went ahead and moved to the glide scope. I'm assuming because of swelling, we couldn't get visualization. We tried bougie. We didn't have success with the bougie. We were able to get the physician to insert a cricothyroid. We were able to ventilate the patient with that. We do now have chest rise and fall. Chest x-rays been shot. Our vital signs are currently as stands, and no medications have been given at this point.
That's an accommodation.
Oh, sorry, we were still good. Yeah, we did RSI the patient, sucks and accommodate, and
Alright, we'll take it. Okay. Alright, good job, guys.
Alright, this is really good.
This is really good. Alright, let's quickly debrief.
Alright, so we'll always start with what went well, and then we'll look at our opportunities after that. So we'll start with our primary nurse. What went well for you?
I think what went well is we identified what was going on rather quickly. We're lucky in this environment that we have a doctor so close by, so I was able to get a doctor here relatively quick. We tried numerous different approaches. If something didn't work, we immediately tried something else. We tried direct visualization, intubation. We tried LMA. We tried bougie. We finally went to the surgical cric. We had somebody watching the vitals. We were able to maintain a consistent sinus rhythm, heart rate, blood pressure. We never had a bout of hypotension. I don't know what the time was, but he was hypoxic. What else can I see here? We were able to RSI the patient. We were able to get the drugs here relatively quickly. We got the cart here quickly. I think considering for everything that went on, I think it was successful. And I think we took our time. Instead of just jumping immediately to the cric or whatever, we tried different approaches. Dr. Coben was clear and understandable, so.
I think you took that part though.
Oh.
Alright, how about you?
Oh, yeah. I think the only thing we just didn't know.
No.
What?
What
Was
well?
good.
What's good?
Oh, what?
What's good?
Oh, I'm sorry. Oh, I think the whole scenario went fine. Like we said, the communication was there.
Everybody's calm.
We restated the medications when they were given in case somebody forgot. We told them where things were. We direct them where it was, where it's located, items. So yeah, the communication went well. Yeah, everything went.
Dr. Coben kept it calm. It's
Yeah.
always easier when it's calm.
When you have somebody who's calm and not, getting all frantic, because then it makes everybody else all frantic too.
Yeah.
So.
I think just the teamwork with helping each other find stuff. Sometimes like we're not in these parts all the time.
Yeah.
So, and the communication.
I'm a big talker. So I come from the environment of always calling out what you see, what you're doing. So for me, that's always helpful.
Oh, yeah.
That's like the best.
He's very shy.
Yeah, exactly.
How about you? What?
Oh, I think everyone being able to like go grab the different equipment that we needed to go through and try different options to try to isolate the patient. So I think that was really good. And people being aware of like, do we have breath sounds? Are we able to move the air?
How about you?
Oh, yeah, the teamwork. Communication.
And you had like one designated runner too, who was.
Yeah, another one for a runner. Yeah.
But it's
Yeah,
unfortunate in the real world situation we didn't have 100 people here. It's total madness. It'd be nice if it was like this, where like they say in the trauma room, look, if you don't have something to do, leave. Yeah, I know that's not reality.
Yeah, and then so that's why your lead or your manager, like who hears that emergency, it's like kind of come in like Carlton's way. So that's really important.
Yeah, because we'll get anesthesia checks, we get everybody whenever it's called.
Yeah, too many people is not always a good thing, right? And I think you guys said you remained calm, and I think that kind of helped everybody hear each other too. And the document never had a hard time hearing. There's a lot of call out, there's a lot of check on the patient, like close the loop with the patient all the time. We're doing intervention, but we're also checking on, do we still have a pulse? And anybody was still confirming if we had a pulse. When we drew up the medication, okay, they're given, I drew it up, which one do you want first? So that kind of helped close the loop with the ordering provider too, to say, I'm giving this and then I'm giving the sucks, and so they're ready to intubate. So we want to make sure they're ready, right? Because otherwise, you don't want to take away what you give back. All right, opportunities. Anything you would have done differently, or even just not yourself, but like as a resource, or anything that would be different.
I mean, for this group, Eric he knew almost where things are. Like he would like, go get, it's on that, in that room 215, room 215, you go get stuff. So, but you may not have Eric all the time in your situation. So just make sure that, these equipments are where they are. So the good opportunity, the good part is that you have someone very resourceful in your code team, but at times when he's not available, then it's best where things are.
Even with the log, that you guys are keeping it at the bottom where the rest of the department is.
And it's tough because things move here all the time. Not in a bad way, but things moved and adjusted and.
Right. So that communication piece needs to, maintain, because this is in an emergency situation. It will not be the place where you want to start looking for your equipment.
Yeah, one time we were doing simulation in the CDU, and the IO drill was missing. And what happened is they had an incident, a few days before, and someone forgot to put it back in. So they looked for it all over the place and they couldn't locate it. So it's always good to, I agree that you put things back and also communicate that it's been used, but now it's back into the card.
So with this scenario, we did this earlier at 7 a.m. and they had the algorithm, the difficult airway algorithm. You guys went through it in a very similar pattern of what they did, but it's probably a good idea to have that checklist available for you guys. Okay, we're having a guy with a difficult airway now, so what do we need to do using that checklist, so we're not doing it by memory. So like your provider can only do like 2 attempts of the same interventions, right? So that's good to know, because if you have the checklist, because she might be just trying. So she might not count, how many times she's doing it. She's just, what if she needs is like, I need an airway, established. So it's good to have that checklist say, hey, you've tried that twice now. Algorithm calls for the LMA, which you called for, but it's good to have that checklist to say, hey, this is where we are and where do we need to move forward. Because you got ready with the corrective, which is great, because that was what was coming. But that was also on the checklist. And then you can also evaluate the checklist when we use them to say, hey, this doesn't work the way it's written, we need to change it, or this is not current practice, or something like that, so you guys can see what you have available under your resource, or it called for something and you weren't able to locate it. So use your algorithm as well to just see what would be next.
Yeah, it should be usually sits on the difficult airway part.
Oh.
And the backside really gives you like a written statement on what should be happening. If you're not very good with reading algorithm, then you can just flip it and see what.
It's a step by step.
Yeah, it's step by step.
And if for your document or two, so she can just say, okay, attempted, and then responses. So you guys have a document, because this becomes your legal document of what occurred, right? Because you're not at that moment documenting what's going on. One opportunity to kind of look at, make sure you guys.
But you guys, I think you went through the whole thing, and while you're waiting for the difficult airway, you guys use the other resource you have available, which is your code card, and then you have the log.
And I thought it was good that we kept going back and just verbalizing the steps that we have done. We tried BBM, we tried this, we tried that.
Yeah, so you tried normally and then you went to the kaleidoscope, so you're like trying this, trying that. You still have a pulse, so you don't have to go there, and it's just respiratory.
Is this intubatable?
Yeah.
Yes,
That is so.
yeah, he is. And you just would always see the cords, even when you're trying to do the full airway. That's why
we said you
didn't
can,
want
you
you to
can
see the
intubate.
cords.
I don't want you to say I intubated, but you
Yes,
know,
I can
what are
see
you
the
talking
part.
about?
I intubated. I did.
I went through.
I think they have somewhere they can make it difficult.
Yes,
We have
the
one of
other,
those.
Wow.
yeah, you can create resistance and you have that. But
Doesn't Simman
yeah,
and
the
ALS
ALS can do
two
it.
of the
You can
other
put
ones.
resistance, you can't advance.
Yeah.
It blocks it. But again, you know, sometimes people think, oh, this is a mannequin, that's why I'm having a hard time going in, but it's really designed to block it.
Right.
So, but this one, you can just go through it with no problem. It's just open.
Any other thoughts?
Any other, you guys did a really good job.
Thank you.
All right, thank you.
Thank you.
I don't think you tossed anything out, right?
I don't think I put everything back.
This needs to go
Just
back.
gonna wait for the next batch.
This goes, that goes there, and then this goes in the bottom.
Can you get out of this one?
It was.
Yeah.
That's a lot
Oh,
of
yeah,
stuff.
yes, it is. It's a lot of stuff. All right.
I don't know where you are.
That's what I say. See, go first and get it over with. Get it done. Do you want us to watch this? Or you guys gonna have another group?
We're gonna have I think two
We're
more.
gonna have another one at 12. Just, yeah, put it where it is.
Yeah,
That's
you could
perfect.
leave it. Thank you.
Thank you.
I know they're not gonna know that we know, but it's obvious.
But he's a flight person. He was. I don't know if you saw that. I mean,
That's why he's very
humble.
Because
Because that's what I was.
I used to have